aseptic technique and USP 797 guidelines. So right now we are outside in the main part of the pharmacy. This part is not pressurized. This part is not sterile. This right here, from this line on the floor to this line on the floor, is called the anteroom. This is the part between the outside of the pharmacy and the clean room or the buffer room. This area gets something called ISO 8 quality air. Once you step through into the clean room, you are now in ISO 7 air. And when you start to work within this hood, you are at ISO 5 air. So the anteroom right here is the room that you use to put on your garb, or also known as your PPE or personal protective equipment. It is separated by clean and dirty parts. So when you first walk from the outside of the pharmacy, you walk into the dirty part of the anteroom, and then you step over the middle of the anteroom, which is called the line of demarcation, and usually it actually is indicated on the floor. So right here we have the line of demarcation. Step over it, and now you're in the clean parts of the anteroom, and that is what leads to the clean room or the buffer room, depending on what you want to call it. So right now, once again, I am on the outside of both the clean room and the anteroom. I'm in the normal part of the pharmacy, and I'm about to garb up to go in. But before we get into the anteroom, we want to make sure that our nails are nicely trimmed. We do not have nail polish on, we have no makeup on, and we have no jewelry on. If any of those things are true, we need to take those off. Next, I want to make sure that my hair is nicely tied back. And then I want to add some booties or shoe covers. Next, I'm going to step foot into the anteroom, and I'm going to start to garb or apply my PPE. So the first step is that you always want to kind of go from top to bottom when you are garbing or applying your PPE. So in the first step of going top to bottom, we need to make sure that we apply a bonnet or hair cover. Anterooms will usually have mirrors to make sure that you get all your hair within the bonnet. Next, you want to put goggles on. This is usually an optional step, but I think it's an important one. If you have a beard, you would also apply a beard cover at this point. So like this. Next, you want to apply a mask. Make sure to put the bonnet over your ears again after you apply the mask. And then lastly, another pair of booties as you cross the line of demarcation. So this is all the PPE that you don on the dirty side of the anteroom. Now we're going to sit down. I'm going to put one bootie on one foot. I'm going to cross it over the line of demarcation, put my other bootie on my other foot, and stand up. So now I am on the clean side of the anteroom, and now I can begin my hand washing. First step in my hand washing is usually you would have a foot pedaled sink. It's possible you won't. So if not, turn on the sink, let the water run. You would get your hands wet, fingers wet, your arms up to your elbows. You would get a nail pick and clean the bottoms underneath your nails. Even though your nails are short and nice and trimmed, you still can get things underneath. So it's important to get all of that out before you sterilely compound. Okay, so after you're done cleaning the bottoms of all your nails, then you can apply the soap that is provided. Clean all of your fingers, the front and backs of your hands, and then your wrist all the way up to your elbow. When you're rinsing this, you want to rinse with your hands elevated and the water dripping to your elbows, because you want all the dirty to go down. You don't want it to go near your fingers where you're going to be compounding. So after you're rinsing and letting all the water go down, you want to get some lint-free wipes, dry your hands, and dry to your elbows. You don't want to go from dirty to clean. You always go from clean to dirty. Now, if this is a foot-pedaled sink, you can just let go of the pedal. If not, and you need to turn the water off, do so with your cloths as to not touch the sink. Throw them away, and nothing else must be touched at this point. And if it is, you have to rewash your hands. The only thing that can be touched is your gown, because your gown is sterile. Gowns would always be placed at least 3 feet away from a sink. I just don't have a lot of room right now. So most of the PPE is donned on the dirty side of the anteroom. Hand washing and your gown is donned on the clean side. Okay, so now that I am all set, I am ready to enter the clean room. Now that we're in the clean room, we need to don sterile gloves. So though we are theoretically sterile at this point because we did our hand washing, we still need to foam. So the first step before donning sterile gloves is to foam your hands just to make sure that they are sterile. So rub that in, let that dry. Once that is nice and dry, you can select your size of sterile gloves. I personally use the small ones. Open the packaging. And then you're going to open the paper and rest it on a table. You want to make sure that the part that says right is on your right, the part that says left is on your left. Open it up like a book, and then you'll have your 2 gloves right here. So I am right-handed, so I'm going to take my left hand and pick up the top part of the glove. So not the fingers, but the part that's rolled over. I'm touching the part that's eventually going to go inside of the glove, not the part that's going to go outside, because the part that's going to go outside needs to remain sterile and I cannot touch it. So touching this part, it's rolled over. I don't know if you can see, but this right here is the line of the top where the glove will be. It's folded. So I'm going to take my non-dominant hand and I'm going to slip my dominant hand inside. So slipping my dominant hand in, and I'm not going to roll this cuff over yet. I'm going to leave it as is. Now that I have my sterile glove on, I can go underneath that fold of the other glove. So I'm going to slip 2 fingers. I'm going to slip my index and my middle finger into this glove. You see how I slipped it under the fold? I'm going to take my non-dominant hand and slide it inside. I can touch what's going to be outside now because I'm touching it with a sterile glove. So now I can roll over, rolling over my gown as to not expose any skin. Now that I have my sterile glove on, I can then go in underneath the folded part of the glove, and I can roll it over my gown on this side. And that is how you apply sterile gloves. Even though we've applied sterile gloves and it's probably sterile, we still need to then spray our hands with 70% isopropyl alcohol spray. And this is sterile isopropyl alcohol spray. Whenever you're inside of the clean room environment, you need to always use the sterile 70% isopropyl alcohol spray. So I'm going to spray my hands, rub them together, let it dry. And once that is dry, you are ready to start your work. Able to don sterile gloves when working in a sterile compounding pharmacy is super important. Without being able to sterilely compound gloves, you cannot work. So when you first start your job, they will actually have you apply your sterile gloves, and then they will test your fingers to make sure there are no pathogens. They will take a petri dish and dip your fingers in it, and if anything comes back, if anything grows, then you cannot compound. So this is done yearly. Another thing that's done is that they make sure that you can actually do the math. So they'll actually not only make sure that you can sterilely apply gloves, they'll actually give you a math test because they want to know that you can do these calculations. Because if you create errors in this, you could really mess up drug dosing. Just giving you guys a view of what I'm seeing in the clean room. Remember, the clean room or buffer room, whatever you want to call it. This is ISO 7 air that we're in. Within this hood right here, this is ISO 5 air. So remember, when you're in the hood, you want to work about 6 inches inside. Here is a cart. This is where we put all of our supplies that we'll need while compounding. We don't put it all directly in the hood. We put in the hood as we need, and we always clean everything off beforehand, even though it's already in this sterile environment. So anytime we need a paper, so like let's just say this is a work order, it needs to go in a plastic slip as to reduce particulate matter. And this is just little particles that get into the air. So when I say ISO 8, ISO 7, ISO 5, this is all a measure of the amount of particulate matter or particles within the air. And we want that to be as low as possible while we're making these meds. So in these bins, I have my different orders. These are, remember, our low-lint wipes. This doesn't create a lot of particulate matter like most wipes would. This is 70% sterile isopropyl alcohol spray. This is the main cleaner that we'll use in sterile compounding. A calculator to do all of our calculations with. A marker, so that way we can write expiration dates on vials and bags as we need to. These are syringe caps, some needles, some alcohol wipes. We'll use a lot of these. And this is a cleaner called Preempt that we use daily to clean our hoods. Depends. Some pharmacies will do it in the morning, some at night. It depends on your pharmacy. But daily, the hood will be cleaned with Preempt and then wiped down with isopropyl alcohol. In between that, in between batches, in between shifts, whatsoever, you would clean with the 70% isopropyl alcohol spray. Let's say there's a spill. If there is a spill, it's always best to clean it with sterile water and then go through with the 70% isopropyl alcohol spray. So no matter what cleaner you're using, you kind of always want to wipe it down with this afterwards anyway. Before beginning work for the day, you need to first make sure that your hood has been running for at least 30 minutes. So this right here is a laminar flow hood. So laminar flow hoods need to run for at least 30 minutes to achieve that ISO 5 air before you can begin work. Usually pharmacies don't actually turn their hoods off, so usually you don't have to worry much about this, but just in case, make sure it's been running for at least 30 minutes. After that, it is time to actually clean the hood. So, as I said, usually once a day you have to clean with Preempt and then follow through with isopropyl alcohol. right now, to save time for this video, we're just going to do the isopropyl alcohol. Also, once a month, you need to clean with something called Paradox during deep cleans. So during deep cleans, you actually have to clean the ceiling 2 floors, including the hoods, of a clean room. So that's monthly. And Paradox is a stronger cleaner, is a sporicidal. It will kill pretty much anything, making sure that your compounding environment stays sterile for a long time. So I'm going to start, as I said, I'm skipping the preempt for now. We're just going to go in right with the 70% isopropyl alcohol spray. So right now I have my low lint wipe, and I have my 70% sterile isopropyl alcohol spray. So I'm going to spray my wipe. I'm not going to spray within the hood. We don't do that. We spray directly on our wipes. And we clean our hoods from top to bottom, from back to front. So the first step we do is we clean the ceiling part of our hood. Now, there are 2 different types of hoods. There are vertical flow hoods and there are horizontal flow hoods. This one you can see that the air is coming from the back towards me. So that would be a horizontal flow hood. There are also vertical flow hoods, so sometimes the HEPA filter that is pushing the air down is directly up here. So depending on how exposed that filter is, you might not want to put direct pressure on that. That would depend on your hood and your pharmacy. But right now it is pretty smooth up there since this is a horizontal flow hood. So I can begin work cleaning the ceiling part of my hood. So I'm going to go in the back, subtly overlapping each stroke by, I would say, around 25%, just to make sure that we don't miss anything. So back to front, side to side. Okay, so now I have cleaned the ceiling. I'm going to get a new wipe. I'm going to clean my IV bar hook. So right here is the IV bar. Wipe that. Wipe all my hooks right here, my IV hooks. To get the back of our hood. So starting at the top, going towards the bottom. Overlapping by about 25%. And do as I say, not as I do. You shouldn't be actually talking while you're in a clean room at all, especially when you're like directly facing the hood. So talking creates particulate matter, so you should not be actually speaking directly into a hood. Once again, new wipe, more spray, and we're going to clean the sides of our hood. So for this, you're going to start at the top, going down, and going towards the front. And then I'm going to repeat on the other side of my hood. Top to bottom, going towards the front. And then now we're going to get the table. So we're going to start in the back, and we're going to go towards the front, once again overlapping all those strokes by about 25%, just to make sure that no surface is left uncleaned. I'm actually going to re-wet my wipe and make sure I clean this. This is a shaker, so not all pharmacies will have one. This just helped shake up vials, that powder vials that were reconstituted with the diluent. So this kind of helps speed up the process, but you don't need one, and not all pharmacies are going to have one. So I'm going to go to the bins that I have right here. And we're going to go through them, and we're going to take out all the supplies we need and put them into the hood. So as I did with cleaning the hood, I am taking one of those lint-free wipes, spraying it with the isopropyl alcohol. And I'm about to wipe off everything I need to then put into the hood. So, grabbing for my first bin right here. And remember, when these things were pushed through the pass-through window, they were already cleaned, coming to us. So these have already been cleaned with isopropyl alcohol, just not sterile isopropyl alcohol necessarily. But either way, since they are going from ISO 7 to ISO 5, they need to be cleaned again. Kind of like, once I start to compound, I need to respray my hands every time I go out and then back into the hood. So anytime my hands leave the hood, before they go back in, they need to be sprayed with isopropyl alcohol. That's with any item. So cleaning all the vials that we're going to need. And I'm not putting everything in at once. Notice I'm just putting in per order. I'm not putting all the supplies that are in my cart. This is just another way to reduce all the trash and particulate matter that is accumulating within the hood. Now, one thing I will admit is that in the classroom here, this is not a working hood, but it is a horizontal flow hood, as I told you guys before. I have not personally, in a pharmacy, worked with a horizontal flow hood. I've always worked with vertical flow hoods. So it might be interesting to see how I am going to hold the vials to show you guys things in order to maintain first air. So while you are compounding, you need to always be aware of where that ISO 5 air is hitting on your items. So if it's vertical, it's always going to come from down. So you don't want to block anything. You don't want to put your hand like over a vial. Like if the vial's right here, you don't want to do this because that would block your first air. That's not going to block your first air if it's coming towards you. You want to make sure that nothing is in back of your items. That includes your hand while you're drawing things up. So it depends on where your air is coming from, how you even hold your vials, how you draw up, where you place things on your table. So just keep all that in mind as we go through. The first thing I'm going to show you guys is how to use a transfer set to recon antibiotics. We have a bag. This is of saline. Normally, you would use, the most common one would be sterile water, but I had a bag of saline, so we are going to use that. You could theoretically imagine it is a larger bag of sterile water for more realistic purposes, but this will do just fine for our example. This is our transfer set. I'm going to open it. So this end of it, the large needle end, goes into this port. This is the port that nursing usually uses to put different lines in. And this is the port right here, the medication administration port, that pharmacy usually uses to inject drugs or to withdraw liquid. So this is a horizontal airflow hood, so I'm going to try not to block my first air, since once I take this cap off, that would be a critical site. Air is coming from here. I don't want to block it, so I'm going to make sure that this is clear. It's touching first air. I'm going to take my cap off of this thick part of the needle on the transfer set. And I'm going to push this in until it's all the way in. There we go. Now I'm going to open up my syringe. I am using a 20 milliliter or 20 cc cubic centimeter, however you would like to word it, syringe. I'm going to open it so it touches first air. The tip, the Luralock tip, is a critical site of my syringe, so I always want it to be in contact with first air. I'm going to lay it down so it is facing my hood. This part of the tip, the part that looks like a circle, not the part that is pointy like a needle, that can help remind you that this is the needle end. I am taking off this end, and I'm going to attach the syringe. Now, I am taking, this is called a vented needle. I am opening it up, exposing the Luralock tip to the first air. I am taking this cap off right here, this pointy part, and I'm making sure to connect them and give that a quarter turn to screw it on. Then you can hang it here as so on the IV line until you're ready to use it. Now that you've spiked this bag, in case you don't use it all, you would write the date and the time in 24-hour time that you use this. These bags, if they stay within that ISO 5 environment, will be good for 12 hours. Whenever you're working within a hood, that would be vertical or horizontal, you want to make sure that your hands are naturally kind of resting 6 inches in. So within 6 inches, that is where you should be working. That's where the ISO 5 air is hitting, and that is called your direct compounding area, or your DCA. Because this is a new line, there's not actually liquid in the line yet, so we have to prime the line during a first use of the tubing. So after this tubing has been used, it doesn't need to be primed again. But this one has not. I mean, we just took it out of the bag. So, how do we prime the tubing? We draw back on the plunger of the syringe until we see liquid being sucked through this tubing into the syringe. So right now, I see I got a couple milliliters into my syringe. So right now, I am going to slowly, very slowly, otherwise you're going to make a mess, push upwards on my plunger until that liquid gets to the top of the needle. Okay, it's primed now. So I'm going to recap my needle for now. Oh, I forgot to show you guys how to recap. So some people, this is the safe method for recapping, will put the needle cap on the table and do a swoop method and then put the needle in there and cap it. I personally, when I'm recapping a needle, will hold both of them at angles. I guess this would be about a 45-degree angle upwards. And I connect them, and then I join them. That's how I do it. You don't want to just go in like this, though, because eventually you're going to get stuck. You want to be careful. Sorry, guys, I realized that I forgot to put a new sharp spin in this hood. So I went and did that real quick. So that way, as we continue, I actually have somewhere to put these sharps that I need to dispose of. So my apologies that that was not in there sooner. So now that we have a primed line, we can actually use this as our diluent when reconstituting. If we're, this is really helpful if you're using multiple vials that need reconstitution, not just one. If it's just one, you could use a small vial of maybe sterile water or saline, which I'll show you in a later example. But right now, this is if maybe we have batch orders. So let's just say this is one of the vials that needs reconstitution. This is called a dust cap. We take these off by holding the vial and popping it upwards with your thumb, making sure not to hit the HEPA filter. Doing that more cautiously. All right, so now we have our sterile isopropyl alcohol pads, and we're going to use these to wipe the tops of our vials. We're going to let that alcohol on the top of the vials dry first. So if you read these actual vials, it tells you how much diluent to add if you're not sure. Obviously, if you've been working with the same vials for a while, you usually kind of know. But let's just say this is one I'm not familiar with. So on here, it says that you need to add 9.6 milliliters of diluent. So remember, that could be this. If we're pretending it's sterile water, it's that. If not, this is actually saline. So, and then that will make 10 milliliters of total solution. So if we're adding 9.6 milliliters and we're getting 10 milliliters total, so that would make the powder volume of this vial at 0.4 milliliters, which is just subtracting those two amounts. So I'm going to draw up approximately 9.6 milliliters. I have that. So keeping in mind where my ISO 5 air is coming, since now we have the needle exposed, we have the stopper exposed, both of those being critical sites, we want to make sure to go in at a 45-degree angle in the middle of our stopper. Once again, we're working 6 inches into the hood, directly in that direct compounding area. So 45-degree angle, and I want to turn it to become a 90-degree angle as I'm pushing into the stopper. So we want our bevel up. That's the little divot in the needle. By the time I can't see my bevel anymore, it should be at 90 degrees. So here I am puncturing at a 45, slowly putting pressure down and slowly turning. There we go. So now, vial is punctured. We have our diluent right here. We're going to push down on the syringe plunger. And because we used a vented needle, we don't have to worry about weird pressurization issues within that vial, because there are little holes in the needle that's helping with that pressure. Okay? So recapped, hung back on there. And this is our reconstituted vial. So we can put it on the shaker. I don't have the shaker turned on, but usually this would be moving and shaking that to make the powder dissolve. So let's act like we have one more vial to reconstitute for that order. And let's assume it's the same lot for both vials. If it's a different lot, we should be changing our needle, even though it's the same drug. But let's say it's the same lot. Same drug. We can use the same needle. So we're going to draw up, once again, 9.6. We're going to go bevel up at a 45-degree angle. We're going to slowly push into the stopper. And by the time we can't see the bevel anymore, we should be up at a 90-degree angle. Fully push down. Push down on the syringe plunger to make sure all that diluent gets inside of the vial. Okay? And remember, because we plan on using this possibly on other orders, and because we're using a vented needle, we don't ever want to draw up. We only inject using this. So putting this here. Now let's just say we have one more for a different order. And let's just say it's a different drug too. So we have a different antibiotic for another person. We don't want to use the same needle on different medications because that could contaminate it. So what we're going to do is get another needle. We're going to take our old needle off, and we're going to dispose of it in a sharps bin. We're going to take our new needle and put that on before we even think about reconstituting a new medication. So this particular drug requires 2.5 milliliters of diluent, which is this, and then it becomes 3 milliliters of solution. So that means that the powder volume of this drug is 0.5 milliliters. So with our new needle, I'm going to draw up 2.5. Going in at a 45-degree angle, bevel up, slowly pushing in until that's 90 degrees, fully pushing down, and then pushing down on that plunger to release the diluent into the vial. Once that's all in there, pulling out, and ideally you would want to replace the needle just in case someone else comes and compounds after you. You don't want them to accidentally use that needle on another order. Just because a lot of the times when you're using these, you're reconstituting antibiotics. And there are people that are allergic to certain antibiotics, so you don't want that getting mixed. So, hang that for the next person. So as I said, this is usually when you're making multiple antibiotics with the same type of diluent, if you are making a large batch of antibiotics. But let's just say, for example, that we only need to make one vial, and that we don't necessarily need to keep using the same diluent. We can use one vial of the diluent rather than a bag and a transfer set. So this is a small vial, 20 milliliters of sterile water, and we're going to use this to reconstitute this instead of using this whole transfer set. So I'm going to pop my top using my thumb more carefully. I'm going to wipe both my sterile water, which is going to be my diluent, and the powder that I need to reconstitute. Both of those stoppers are wiped. I'm going to get a syringe. Here we need to add in 9.6 milliliters of diluent, or this sterile water. So I'm going to actually add in a little bit of air. You can add in 30, 50%. I wouldn't add in too much, maybe about 30% of whatever you're trying to draw up the air. It doesn't have to be exact. So once again, going in the middle of the stopper with my bevel up at a 45-degree angle, slowly turning while I'm pushing in. And I'm going to slowly push in a little bit of air, take out a little bit of liquid, push in a little air, take out a liquid to equalize the pressure in the syringe and in the vial. And this is called the milking technique. I'm hitting the syringe barrel just to try to get some bubbles out, because this will affect our overall measurement. Notice how I'm holding the vial like this, so that way we get good first air going. Normally, if I was in a vertical flow hood, I'd probably hold it like this. But since I want to be cautious of that horizontal flow hood, I'm holding it this way. And we need to pull up 9.6. So right now, I'm slowly pulling the vial out. And you're going to have a little bit of pullback once it leaves, just because it's still a little pressurized. All right, so now I'm going to recap my syringe. So I told you guys I do the technique where I hold them both at angles, and then I slowly join. I'm going to remove my standard needle, and I'm going to add a vented needle, making sure to maintain that airflow. If you block airflow, I keep telling you guys you want to maintain first air on your critical sites. If you block this first air, it's something called shadowing. So, since we're not actually making a sterile product, since this is a horizontal flow hood, if I had this vial right here, right back, that would block the direct air that's coming forward. So that would shadow it. If this was a vertical flow hood and I kind of kept doing this with my hands, that would block the critical site. So that would shadow it. So now that we have our vented needle on, we can reconstitute. So vented needles are good for equalizing pressure and injecting. There's another type of needle that's good for drawing up. It's called a multidose or a mini spike. They're also vented, but they draw up. These inject. But usually a standard needle can be used for either. These are just easier. So there we go. Usually you want to save the syringes that you can to draw back to show the pharmacist for your final check. Since we do have this little sterile water vial, I will give this to the pharmacist in the bin, so that way they know that this is what I used to reconstitute that product with. So now I'm going to start a new order, and this order deals with a multi-dose vial. So multi-dose vials are vials that are good for up to 28 days after being punctured because they have extra preservatives inside of them. So popping the top. Cleaning the top of this. Now there's a sticker on the multi-dose vial, which you can write the day and time in which this vial was punctured. So you need to do that so that way people know if it's expired or not. So, since it's a multi-dose vial, and in order to prevent coring, we use something called a multi-dose spike. So, you go in like a standard needle, you find the bevel, you go in at a 45-degree angle, and you push down at a 90 degree. So now we have our spike in. This part can twist off. Keep this because you'll need to twist it back on once you're done using it. So make sure not to throw that out. Now we have a 5 milliliter syringe. Let's draw up 4 milliliters from our multi-dose vial and inject it into this 100 milliliter bag of sodium chloride, normal saline. So with these, this is the needle. You don't need to add a needle onto your syringe. Just grab a Lurlock syringe, twist it on to the multi-dose spike, like so. And since this is pressurized, you won't really have a problem with drawing up like you would with a standard needle. Or sorry, not pressurized. Since there's holes in this, this is vented. It's not a standard vented needle. It's a vented needle that you can withdraw with. So the other standard vented needles you can only inject with. So now that I have 4 milliliters, I'm going to twist that off. And I'm going to put a regular needle on, making sure that I'm not blocking first air. Regular needle. So we want to inject or withdraw from this port, the one that's on the left. I'm going to wipe it first. I'm actually going to hang the bag. And we're going to take our 4 milliliters and we're going to add it to the bag. And there we go. Now I'm going to put that needle in the sharp spin. I'm going to recap our multi-dose vial. I'm going to pull back my syringe to 4 since that's what we added. We added 4 milliliters. So that way I can show the pharmacist. So I'm going to send this out at 4 milliliters with my bag to show that 4 milliliters was added. So that's going to be sent back out in the same bin through the pass-through window. So now we're going to start an ampule order. So ampules are little glass vials that are broken in half and liquid is then withdrawn from them. They need to be filtered because there's always that possibility of glass fragments being within the liquid. So since I had to leave the hood to get my supplies and clean them off, I'm spraying my hands before I put them back in the hood to work. Okay. So I took a few options over here just because not everyone uses a filter straw. I personally like to draw up liquid from my ampoule using a filter straw. Some people do it with regular needles and filter it after, so I'm going to show you your options. But normally you would not need this many supplies. So this ampule contains only 1 milliliter of medication. I grabbed a 3 milliliter syringe to get the product with. So, how do you use an ampule? The middle of an ampule, I don't know if you can see, has a line. This line is where you break it. This line is also where you wipe it. So here, I'm going to wipe my ampule right where it's going to be broken. I'm going to go to the side of my hood. I want to break towards the side. So after it's been wiped, break towards the side of your hood. And then after that, you need to clean your hood just in case there's glass fragments. So holding it with the wipe, just in case, because you don't want to cut yourself. I'm going to break it in half. I snapped it. So now you can see the top of the ampules in my hand, in my dominant hand. This part's in the other. I'm going to keep this part flat on the table, and I'm going to throw the other part directly into a sharps bin. I'm going to take my 5 milliliter syringe, or sorry, 3 milliliter syringe, and I'm going to attach it to a filter straw. So with any kind of filter device, this is a filter straw. You can really only draw up with it. You can't inject. With other filter needles, you can do both. You can draw up or inject. But you only want to do one or the other. Because if you're drawing up, the particulate matter is on the other side of the filter. And then if you inject, then you are literally pushing it back out. So you want to pick one or the other and only do that. But here, with a filter straw, you can only draw up. So I'm going to put the straw inside of the Ampoule. And I'm going to draw up all that liquid, making sure to give it first air. Now that that's drawn up, I can remove the filter straw. And let's just say I'm injecting this into another bag. I can add a standard needle to inject it into the bag. If I'm using this on its own, I can add a cap to it. So sometimes maybe I would need to just give this syringe. You can add a syringe cap. So that way you can send that as is. So either way, there's an option for it. But you want to first remove the filtering device. Let's just say you were one of the people that didn't like to use a filter straw and you wanted to draw it up using a Launer needle. You can do that by attaching this to a filter disc. You can have a filter disc in between your syringe and your needle. That would filter it, and then once again you would change that before you attach a regular needle to inject or whatsoever. You could also directly use what's called a filter needle. This is a filter needle. So right here, in between the needle shaft and the lure lock connection, there is a small filter within the needle. So there are some options for you there. I'm going to throw out the empty part of my Ampoule in the sharps. And as I said, now I need to clean my workstation just in case we had some glass fragments. Okay, so the next example we're going to do is we're going to assume that we withdrew some liquid into a syringe, and then we looked inside of the syringe and there was a core. So here we have our vial. I'm just going to wipe it. Then we are going to get a needle and draw this up. We're going to draw up about 10 milliliters. Because that's how much product is in this vial. We're going to draw up pretty much the whole vial. So cores can happen if you're not using the technique of bevel up, going in at a 45-degree angle, turning it to 90. If you're not using proper technique, you can core. Cores can also happen if the vial is cold. Cold vials are more likely to core. Cores can also happen if the vial has been punctured too many times. And sometimes cores just happen, so it's important to know what to do. So let's just say there's a core in here. We're going to take off our needle, and we're going to attach something called a filter disc. So this is a filter disc. We're going to attach that to our needle, or sorry, our syringe. And then we're going to attach something called a lure lock connector to the other end of our filter disc. And then the other end of that, we're going to attach another syringe. So now we have something that looks like this with the filter in the middle. Now we're going to push the product from one side of the filter to the other. Now remember, with a lot of filters, we can either inject, we can withdraw, but we shouldn't do both together because then we are literally pushing that core from one side to the other, and it's kind of pointless. So if you draw up, you get the particle in the filter, but then if you inject, then that particle is then injected back into that solution. So not a good idea, pick one or the other. So here, we injected into the other syringe, and now we're going to take this off, and this should be particle free. Let's just say this is an IV push, so let's just say we are giving it to the patient as is in the syringe. I'm going to take these. These are syringe caps. I'm going to literally place my syringe in there on top, push pressure, make sure it's secure, and that's how I would give it to the patient. You could add a filter disc and a standard needle, and you could use it that way. So think about this, but with a needle attached instead of this Lurlock connector. Or you could add what's called a filter needle. So this right here is a filter needle. In between the needle shaft and this Lurlock connection, there is actually a filter. So rule of thumb for using both of these, either the filter disc with a standard needle or just a filter needle, remember, inject or withdraw, don't do both together. Either pick one or the other for that needle. So that is that. So now that this order is done, now it's time to clean up. Let's act like this is the end of our shift. Okay, so remember, we always want to wipe all work surfaces down. So I'm going to go through and at least wipe my table down for now before another worker comes to make a batch. Now let's just say I'm done. Maybe it's my lunch break. I'm getting out of here. I would put my orders through the pass-through window to make sure that they are then checked by the pharmacist. And then I would start doffing or taking off my garb or PPE. So I don't do that until I go back through the ante room. So here I am, moving backwards. I'm now in the ante room, you can see by the sink and all that. Let's just, for the sake of it, act as though I am coming back in here later to then compound more. The first thing I want to do, in general, is take off my gloves. And you do this by trying not to touch the outside, so taking them off like this. Throw them out. Then you want to remove your gown. You can reuse this. If not, you can throw the gown out. If you're going to come back in after your lunch break, you can hang it up in the ante room. You just want to make sure it is at least 3 feet away from the sink. So here I'm going to hang it on this hook right here. Then you want to leave doing things in the proper order. So you want to first remove your goggles, then your mask. If you have a beard cover, you would do that now. Then your bonnet, and then your shoe cover.